India's fight against coronavirus. Let's look at the big developments at this hour. India's number of coronavirus cases have increased in the last 24 hours especially, but today the cases have increased about 22 of them, causing it to rise to about 258 in total. After the biggest single-day jump in the number of cases, which was yesterday, at least 22 new cases that have been reported today, but about 63 were reported on Friday. Well, Uttar Pradesh has also, in Delhi, the number has gone up, but there's now a third case in Bengal. While singer Kanika Kapoor was booked by the Uttar Pradesh police for her negligence, and 3 extra trains from west to north India after a huge number of passengers wishing to travel from Mumbai, Pune and Nagpur, while a notice for TRS MLA for breaking self-quarantine. The number of confirmed coronavirus cases in the country has jumped to 258. 22 cases have been reported today itself. This marks the largest single-day jump in the outbreak, which was in the last 24 hours. On Friday, 63 cases were added. At least 4 deaths have been linked to this very virus. The Health Ministry has urged people to follow the Prime Minister's curfew call in response to the spread of this virus, which is tomorrow from 7 a.m. to about 9 p.m. The centre has shut down borders to international flights and suspended incoming visas for now, while the states have closed public spaces and asked people to work from home. Now let's bring you a graphic which shows how the number of new cases have spiked in one single day on a Friday. Cumulatively, the number of cases are showing a rise in India. But in India, the coronavirus positive cases are mostly related to those with international travel history or transmission from someone with a travel history. The random sampling test done by the Indian Council for Medical Research says community transmission of the disease has not been documented till now. Once the community transmission is documented, the testing strategy will have to change. So who is India testing right now? Let's find out from Rishika, my colleague.
Well, absolutely. There is a slightly expanded scope of individuals who India is testing for the COVID-19. This was, remember, restricted initially to travelers from COVID-19 affected countries. That, of course, was later expanded to all international travelers. So who is India testing right now? This is important to note. All travelers with an international history, people flying in from different parts of the world, are being advised 14-day self-quarantine. If they develop symptoms, they are being tested. If you're a family member directly in contact with somebody who is a lab-tested COVID-19 positive patient, then you too are being kept in 14 days quarantine. If you develop symptoms, then you are being tested. Now, this is, of course, a standard process that has been followed. But in order to check for community transmission, the ICMR has expanded the scope of testing to those individuals admitted in hospitals across the country with any symptoms of respiratory diseases. So their samples are being tested as well. The ICMR, which is the Indian Council of Medical Research, which is the nodal testing body for the COVID-19 in India, has maintained that there is no local transmission. All of the COVID-19 positive cases in India are those of individuals with a travel history or individuals who have come in contact with a lab positive case of an individual with a travel history. This is, of course, extended to health workers as well. So if you are a health worker and you have developed any kind of symptoms, you are being tested for the COVID-19 as well. And if you are somebody with a predisposed condition, so if you have a predisposed health condition, or you are above 65 years of age, you are considered the high risk category. If you've come in contact with a lab positive case, irrespective of whether you're symptomatic or asymptomatic, you are being tested. So the spike in numbers in India, at this moment can also be explained by the fact that there is an expanded scope of testing for COVID-19. Back to you.